organized provision of medical care for individuals or communities. Healthcare spans from very broad to very narrow in regards to different aspects of a person's health.
Our group chose to do healthcare because we wanted to make a difference within our small campus community and hopefully expand it to surrounding areas along with other schools. We have each been impacted by healthcare systems and wanted to change the stigma around it.
Underinsured or not insured?
Yes.
I would say like 30.
30%?
30%.
It's actually only 8.8%.
At least 7.
At least 7%? Yeah, it's 8.8% of Americans.
People ages 18 to 28 transitioning from being covered by parents or having no insurance to getting their own insurance are most affected by the high cost and confusions of healthcare. Whether that be undergraduate students, graduate students, or those transitioning from being a student to adult life, most are in debt from student loans and do not fully understand their options for healthcare after they leave school.
People in this niche group are looking to start families, may not know their healthcare history, and have other high bills that are affecting their social status as well as mental health. Most students who come right out of college also have job insecurity, as most do not know what they want to do right after they get out of school. Or they end up getting a minimum wage job just to pay some of the bills. They all have little to no regard of what they should be doing when it's pertaining to their health.
To give you an idea of what an average insurance plan looks like, here's what we found. The average premiums and deductibles nationwide for unsubsidized, where you're responsible for paying all interest, for individual coverage averaged $440 per month, while premiums for family plans averaged $1,168 per month.
60 to 90% of all medical expenses are covered, but it all depends on if you meet your deductible or not, and what insurance plan you have. Here are a list of things that are not normally covered by insurance: adult dental services, children's glasses, weight loss surgery, children's dental checkups, acupuncture, private nursing, weight loss programs, infertility treatments, cosmetic surgeries, and all long-term care.
The United States federal government offers for those who cannot afford their own insurance plans 2 different options.
Medicaid is targeted towards low-income families, and it mainly covers doctor's checkups, nursing home expenses, in-home care, as well as hospital expenses. It does not cover any need for prescription drugs.
Medicare is targeted towards the older people of the community. Medicare comes in 4 different plans. A covers hospitalization, B covers doctor's visits, outpatient costs such as physical therapy and diabetes testing. C provides alternatives to parts A and B, but you have to buy it, and D covers drug prescriptions, but you also have to buy it.
To gather information directly from the age group that we were focusing on, which is 18 to 28, we conducted a survey, and so the results of the survey are that everyone who took the survey has some type of health insurance. That only 75% of the people have been able to afford all health care services they have needed, and only 69% have been able to afford all health care treatments. Those services and treatments include things like checkups, vaccinations, ambulance rides, surgeries, EpiPens, and hearing aids. Overall, the feeling about how the current healthcare system in the United States is that only 63% of people find the system somewhat efficient. Everyone else found it somewhat inefficient or inefficient. We also asked if get well care packages through the Parents Association would be beneficial to students. These care packages would include items like tissues, hand sanitizers, a thermometer, and maybe even cough drops. 63% of participants said that would be highly beneficial, followed by 25% saying beneficial and 12% saying somewhat beneficial. No one said that would not be beneficial. We strive to provide healthcare education and coverage to as many people as possible at little to no cost. We do this in order to promote and maintain a better and healthier society. We can achieve this by working with Longwood Administration, the Health Center, and the Parents Association to provide continuous educational programs, access to booking appointments online, availability of medicine at Elwood's Cabinet, access to thermometers, and the health-related care package.